Good morning and welcome to the weekly dementia blog being sponsored by Spectrum Med. My name is Dr. Hutchings. We just finished up our series on the importance of therapies in the world of dementia. And last week we capitalized because we had so many views on the diagnosis of dementia. We wanted to make sure that we talked a little bit about that a little bit more in depth. This week I'm actually going to talk a little bit about COVID-19 and the impact on our patients as well as the caregivers. Obviously, we've gone through a tremendous change in our social and our environments, trying to stay healthy. And definitely when we look at our dementia population, they're certainly in that window of the folks who are most at risk when it comes to COVID-19. So I've had the opportunity to tour and actually round COVID centers with dementia patients, but I'm seeing not so much in the facility base, but when the patient's actually at home is where we're seeing some of the biggest challenges. First of all, we have just the effort to stay healthy and try not to get sick, so the social distancing and the masks and those types of things. But we've also seen a change in patients' routine when they're at home because they can't get out. We also see that there's a change of environment and definitely a huge change or a decrease in social interaction, which can make things much worse when it comes to dementia, not only from a memory standpoint, but also from a depression standpoint. But also what we see is an impact on the caregiver too. And I have multiple patients right now that are going through this right now is that they don't have that time to kind of get away because of COVID. Many times, for example, I have one patient, one of their favorite things to do is go out to eat and take a drive. And that was a really good way to calm his wife down. So one of the things that we can be looking at for sure is that we have to look at the health of the patient, and we also have to look at the health of the caregiver. So making sure that if we see any signs of depression and change in our cognition, maybe if we see a decrease in memory, a sudden drop in memory. So these things can certainly be due to the lack of social isolation, or definitely the lack of social isolation, but also just a change in our everyday and routine. So it's very important to watch for any signs of depression for sure, and try to have some type of routine, even though it's out of your normal routine. Try to set up some kind of routine during the day and try to stick that as much as possible. And of course, watching for any signs of depression. The next piece I would say too is that it also depends on the type of dementia, but also the stage. So if we're at a stage right now where we definitely feel like the patient's requiring more and more help and assistance, and it's kind of really pulling that caregiver down. We call that caregiver burden. And I try to assess that with every patient, but we see with COVID right now, their caregiver burden and depression is really at its all-time high. So one of the biggest things I'm seeing right now is the struggle is if I put my wife or my spouse or mom into a memory care facility, I can't go and see her. And I know that's a big stress on caregivers and a kind of a guilt upon caregivers. So they're really kind of holding off on doing anything because until we have some vaccination for COVID and some of the restrictions are cleared. I can say though, with the help of the facility, even with COVID, the transition can be very smooth. I've had several of my patients right now that I've referred over from memory care, and it's been a great transition because the facilities are certainly equipped to help manage that transition a little smoother. So as we kind of put all this together, it certainly is a very interesting topic. It's one that I've been asked to do a lecture on at the NARA conference this fall, which I think is a great topic because it really brings in how do we handle the environment, the routines, manage depression, but also looking at the caregiver piece as well. So next week, we're going to start another series. We're going to be looking at the different symptoms of different other types of dementia, and of course, what happens next after we have the diagnosis. So we've had so much attention on the diagnosis of dementia videos that we've done. So the big question is, like, what do we do next now that we have the diagnosis? So we're going to be answering some of those questions next week. Keep your comments and questions coming in, and as always, have a wonderful week, and we'll see you again next week. Thank you.